Hi, everybody. Welcome to Health Systems in the U.S. I am Sarah Bonzo, your instructor for the course. Welcome to the fall 2022 semester. Looking at the roster, I know many of you. I've had you in either operations management or managerial epidemiology. So for those of you I'm seeing again, it's great to have you back in class. And there's a number of new faces in this class as well. So as a part of getting up to speed and getting ready for the semester, I'm not going to try to cram everything in here. There is another video kind of giving an overview of what to expect in the course. But for now, if you haven't done so already, please make sure that you get acquainted with Brightspace. We have just migrated from, as many of you know, if you've taken classes with us before, from Blackboard to Brightspace. So it's a pretty easy transition. It's fairly intuitive, but some things get moved around and might take some time to get used to. So take a look around the course. Please make sure to download the syllabus and order the textbook if you haven't done so yet. So we will use the text primarily in the first half of the course. Looks like this, Stephen Wagner. This came out last year, so it does have some relatively new information regarding attempts to kind of pull back on the ACA, as well as COVID. Although there wasn't a lot that we knew at the time of it coming out, but I like it because it takes this wildly complicated and complex topic and it really distills it down, I think, in kind of an easy to read way. So this week and then the next couple of weeks, it's going to be a little bit heavier in the reading. But that's really just to kind of get us up to speed on what is it that we call this health system, which really isn't much of a system at all. How did it evolve? And so that's really the content that we're going to dive into here in this first module, and also in chapters 1 through 3, which is what the reading is going to be for this first week. Now, I know a couple of you have already reached out and that you've ordered your text, and you're not sure if you're going to get it by the due date. We can be flexible with a due date for that mastery check here for this upcoming due date next Monday on the 29th. If you don't have your text yet, don't worry about it. I would give the mastery quiz a shot. You're allowed to take it as many times as you want, as long as it's submitted prior to the due date. But again, given that people are going to be ordering the text and may not have them in, I'll be flexible on the due dates here for these first couple of weeks. But I do want to make sure that you go through and submit the discussion. So every week we'll have a discussion where I really want you to reflect on your perspective and your experience with the health system. And I also want you to look at county indicators. So look at the health status of your county. Try to find, at least for the discussion this week, I want you to look at some of those health indicators, find ones that are surprising to you. I want you to kind of work through what are the predisposing and enabling factors that may play a role in seeing this health statistic for your county. And then I also want you to think about what are opportunities to improve upon this. It could be with respect to something as large as costs, and how are we looking at insurance coverage, and kind of some larger policy changes, or it could be something as simple as some sort of public health initiative, whether it's patient education, or whether there are maybe some new apps or things that the health system can do to bridge that gap between the services they're offering and what's needed by the population that they serve. And that's really all healthcare is, right? We want to create healthy environments for the people that live and work in our region. And we want to provide services that are going to be most meaningful for them. And as you'll hear in these first couple of chapters, is really right now, and this is probably not new and it's somewhat cliche, is we have a sick system, right? We're kind of always behind the 8 ball in trying to address an issue or a chronic situation, health condition that's already kind of come to pass. And we really want to start looking at how can we prevent these things from happening in the first place. And even aside from preventing the bad things, is how can we bring out good, healthy behaviors? And so there's a lot of work being done in this space. So again, there's a lot to cover here. I would describe this course as a survey course, in that we're not going to go really, really super deep into any single one of the topics, whether it's financing, whether it is really thinking about approaches to healthcare delivery, or whether it's thinking about access, or quality. We're going to hit on these things and we're going to kind of talk about them in a broad context. And I also really love this course in, we've got a lot of people who have a lot of experience in healthcare. And I want you to bring that to your discussions because we're all going to learn from one another and we're all going to be respectful of everybody else's perspective and opinions. And that's going to help us be more critical thinkers about the health system as we know it and what we can do to improve upon it. So one thing I want to show, I'm not going to have slides here. Occasionally I will do videos where I will kind of go through more formal slides because there are key points that I want to reinforce. But for today, I really just kind of want to show this image and it comes from the text. So in the text, and I believe this is chapter 1, right? This is what they refer to as the perfect storm. So all of the forces of change that are acting on our health system today. And for those of you that are working in healthcare, you probably are seeing some of those come to the forefront, primarily workforce and staffing challenges. And we are seeing a major uptick in nursing unions and negotiations between health systems. And it is creating some turmoil. But we also know that it's to some extent warranted, or we can understand the drive for that because you've got people who have been doing their jobs with the same health system for maybe a decade at a certain pay rate. And all of a sudden there are new people coming in that maybe don't understand the processes, the workflows, aren't really vested and loyal to the organization and making significantly more than the people they're working alongside. So it's been creating a lot of challenges, not only in making sure that we have the right staff to be able to deliver care, but culturally, right, and understanding what does it mean to work and be a part of the health system. The other piece I'd like to call out here is digital transformation. One of the things that we've seen with COVID is that health systems have had just this unbelievably rapid adoption of healthcare technology. Whereas if we look back 10 years and looked at, Epic or EHR, implementations, they were long and cumbersome and painful, and they still are in large part. But we're also seeing people kind of quickly adopt to new technologies, new applications that are integrating with the EHR. There is a ton happening in the digital transformation space. And I think that it's this point in which people are frustrated with care delivery as it exists today and finding these niche opportunities to kind of bridge that gap between, again, what we're going to see in our discussion board this week, what is happening at a county level, what we're seeing some of the challenges that our patients are dealing with, and what we're able to do as a health system to bridge that gap and give them what they need. We're also going to talk about in the course things like population health. We're going to talk a little bit about healthcare reform and policy, though we won't do a deep dive because you'll see those pieces more in healthcare economics and health policy. But we're going to kind of continue to kind of play in this space, this messy space of where are we, what are the challenges, and what can we do about them? And I know that so many of you decided to go and get your MBA specifically in health systems administration because you want to make a difference. And I'd like to come into this course with that common thread. And I look forward to meeting all of you and talking a little bit more about what makes you tick, what lights you up, and what can we do as a part of this program to help kind of put you in the position to kind of realize some of those dreams. So as a part of that, we will have one required one-on-one meeting. This is going to be halfway through the semester. I used to do 2. We have a larger course, and I know sometimes it's challenging to meet. I am happy to meet with you as often as you'd like. We will have one dedicated meeting so that we can talk about what you want to work on for your research topic for this semester. And I would like to just reinforce now, and I'll come back to this later on, but I'd really like for you to find opportunities, not just in this course, but in the program, to use research papers and different projects to be able to focus in on the things that really excite you, and where you want to develop more expertise. And so we'll do everything that we can on our end to give you opportunities to be able to do that. If you need additional help or support throughout the semester, please email me at any time, sarah.bonzo@oswego.edu. I also have dedicated virtual office hours, and you can use my You Can Book Me link to set up time anytime you'd like. I've got some dedicated hours in there. If you don't see something that works for your schedule, if you need nights and weekends, just let me know and I'll be more than happy to accommodate. With that, welcome to our fall 2022 semester in health systems in the US, and I look forward to working with you all.